I'm sure you've already done that. Do you want to see faces or not for the talk, Shireen?
Oh, I'm totally easy. I seem to be frozen, but you seem to still be able to hear me okay.
We can see you moving and we can hear you, so that's great.
Okay.
Yeah.
Right.
And if anybody could just put some questions in the chat, and we'll have a chat at the end. I think Shireen's intended to talk for about 20 minutes, and then just to warn you, at about 8:15 we're hoping to have a shortish Greener Practice meeting for our local group, so we will be asking people who are not in the Birmingham and Solihull area to leave at that point after the Q&As from Shireen. And I don't think there's anything else except to press the record, which is already happening. So I will pass it over to Shireen now. Thank you.
Great. Thank you ever so much for the invitation, and to all of you for turning up on what is a rather warm evening, and perhaps highlighting the topic far too close to home, really, of climate change and the other problems we're facing. Just a little bit about me before we start. As Katrina said, I'm a consultant haematologist as my sort of day job. I'm recently certified as a lifestyle medicine physician as well, and I incorporate lifestyle medicine principles into my practice. But I guess I'm here first and foremost today really as an advocate of healthy plant-based diets, and I provide education and advocacy on this topic through my community interest company, which is called Plant-Based Health Professionals UK. You can find the link to my website at the bottom, and I'll pop it in the chat a bit later. I also provide education at the University of Winchester on this topic, and we'll come back to that at the end. And it's always good to declare one's own diet pattern when talking about dietary habits, and I've been vegan since 2013. So what I hope to cover in this short period of time is the evidence supporting plant-based diets for prevention and treatment of chronic disease, understanding international consensus on diet, nutrition and health, and hopefully inspire you to take a pledge and take some action after today. And of course, I will be relating it back to the wider problem that we're all concerned about, which is the climate and ecological crisis. And so why is the diet choices and our food system so important? Well, we really do have to make the connection with our numerous global crises, because our food system is central to our climate and biodiversity crisis. I'll show you how important it is in our current health and chronic conditions crisis. And of course, I think we also have a crisis of ethics, really, whereby we produce enough food to feed 2 planets, yet nearly 1 billion people go hungry. There's people even in the UK, food insecurity, insufficient funds to be able to support themselves and their family with a healthy, nutritious diet. So things need to change to overcome these issues. Now, as a greener practice, you and I and all of us are concerned about the climate crisis. And this latest report from the IPCC was clear. Time is running out. We have less than a decade to turn things around. Yet we can take some individual action and action as communities that really will make a big difference. And they really do put the food system at the centre of this report and recommend the reduction of excess meat consumption as well as the most effective measures to mitigate greenhouse gas emissions, with also a high potential for enhancing environmental health, food security, biodiversity, and obviously, of course, will have benefits for animal welfare and justice. So just to pause on some definitions that might come up as we discuss things this evening. I'm sure you're all familiar with these terms, but it's just worth going over just briefly. So the term vegan really relates to a social justice movement that centres animals at its core. Of course, a vegan diet excludes all animal products, but it doesn't really tell me what somebody is eating as such, really only what somebody is not eating. So it could be healthy, it could be less healthy. Vegetarians obviously exclude animal flesh from the diet, but eat dairy and eggs in general. Flexitarian is a imprecise term, but is increasingly used to describe people who are trying to reduce their meat and dairy consumption, usually for environmental concerns. For me, a healthy vegan diet, and what's used in the medical literature is termed a whole food plant-based diet, which is depicted here, is really a diet centered around fruit, vegetables, whole grains, legumes, nuts and seeds, and mainly water for thirst. And we are beginning to use terms such as predominantly plant-based, which again doesn't have a precise definition, but for me, I use it for for example, the Eat Lancet Planetary Health plate, which is 85% derived from healthy plant foods with allowance for about 13 to 15% of energy from animal foods. Excuse me. So what is the problem with our current food system as it relates to our health? Well, the latest report from the Global Nutrition report comes out every year, but the 2021 report clearly states that unhealthy diets are now responsible for 26% of deaths globally. And in Europe, including the UK, this includes 31% of premature deaths, which are related to our diet choices and habits. In addition, the food system in general is creating 35% of all greenhouse gas emissions. So what is wrong with our current diet pattern? Well, I won't need to tell you, but it's been well defined in this large analysis published in 2019 in The Lancet, which looked at dietary factors from 195 regions around the world. And what it found was that there were similarities everywhere. At this time in 2019, one in five deaths were thought to be related to dietary factors. And the top dietary risk factors were that our diets globally are too high in sodium, which is a reflection of our reliance on pre-prepared and packaged foods. And in the UK, more than 55% of what goes into our shopping baskets is classified as ultra-processed. And then second and third and beyond is due to the fact that we're not eating enough healthy plant foods. So our diets are insufficiently, well, they're too low in whole grains, fruits, vegetables, nuts and seeds and legumes. And this is resulting in common chronic conditions, cardiovascular disease, cancer and type 2 diabetes. And it was estimated that these dietary risk factors were leading to 11 million premature deaths globally. And the issue with underlying chronic health conditions caused by dietary risk factors and other lifestyle factors has been exposed further during the COVID-19 pandemic. So the image from the left was the report from the Open Safely study, 17 million healthcare records in the UK in the first wave, showing that more than 90% of deaths were in people with at least one underlying health condition. And then more recently from the US, 1 million hospital admissions for COVID-19 were analysed, and it was shown that 60% of those admissions were directly related to hypertension, heart failure, obesity and type 2 diabetes, and thus could have been prevented if those conditions did not exist. So what about the foods that do promote health? Well, this is from the American College of Lifestyle Medicine, which is the founding lifestyle medicine organization, founded in 2004, and then the certification, which I have and others I'm sure in this group may also have, was launched in 2015. And it's quite clear about its dietary recommendations. So the college recommend that a healthy eating plan that will prevent and treat chronic illness is one that is based around minimally processed fruits, vegetables, whole grains, legumes, nuts and seeds. So a whole food plant-based diet, half the plate fruits and vegetables, a quarter whole grains and a quarter plant protein from legumes, nuts, seeds, beans, pulses and so forth, mainly water for thirst, and abundant of herbs and spices, of course, for the flavour, but because of their health-related properties. And diet, along with other healthy lifestyle factors, will address the root cause of many of our chronic conditions. And this is just a simplified diagram, just reminding us that so many of the conditions we deal with in the NHS share these mechanisms of altered microbiome, so dysbiosis, epigenetic changes, cellular stress, that ultimately lead to inflammation. And there's a bidirectional relationship here where then inflammation, which becomes chronic, leads to further microbiome disturbance, epigenetic changes and cellular stress. And ultimately, as I say, all of our chronic conditions can be brought back down to a shared mechanism of inflammation. But the good news is that lifestyle interventions, including dietary interventions, can really support prevention, but also management and in many cases remission of these conditions. So just a reminder about what the international consensus is on a healthy diet for humans that is also sustainable and will keep our food system within planetary boundaries. This again was published in 2019. The Lancet Commission brought together 37 scientists from 16 countries around the world to come up with a diet that would not only be healthy for us, but also for the planet. And it's come up with a plate that doesn't look that dissimilar to the plate I've shown you already. Half fruits and vegetables, about a quarter whole grains. The green is plant sources of proteins, so legumes and nuts predominantly. There's a section for unsaturated fats from plant sources, starchy vegetables in brown. And then you've got this small segment here in red and blue for animal source protein and dairy foods respectively. And it's clear that those are not necessary, but depending on your access to food, wherever you are, your general quality of the food, these foods may add certain nutrients. But for us in the UK, there is no necessity as such. And if you choose to consume dairy and animal sources of protein, then this report suggests that it should be around 13.5% of daily calories as a maximum. And this amounts to 1 portion of red meat a week, 2 portions of poultry and 3 eggs. And it's estimated that with this sort of shift in diet, we could save 11 million premature deaths due to dietary risk factors each year. And the reason why these foods are chosen to be part of the Planetary Health plate is because we know that these foods are a win-win for our health and for the environment. So this is a great depiction here from a paper by Marco Springman and the Oxford Food Programme that clearly shows that the foods with the lowest environmental impact yet have the most health promoting properties are the whole plant foods, the whole grains, vegetables, fruits, nuts, seeds, etc. Whereas the opposite is true for meat and dairy. And just a reminder that if we all ate like the UK, we would need 7 planets to feed the world. So we really have to make some drastic changes to the way we are eating. And a recent analysis looking at the benefits for both human and planetary health, if we all adopted the Planetary Health diet, it was an analysis from the EPIC study, which included almost 500,000 participants from 10 European countries, followed for 14 years, using the Planetary Health diet as a reference. And what the results showed was that those who were adhering the most to this type of diet were able during the follow-up to have a 63% reduction in all-cause mortality, and it was estimated that nearly 40% of cancers could be prevented, whilst at the same time reducing greenhouse gas emissions from the food system by 50% and freeing up about 62% of land that would be liberated from animal farming and could be used for carbon storage. So what if today you decide that you're happy to ditch animal products completely? Is a vegan or a healthy plant-based diet, which excludes all animal foods, nutritionally adequate? Well, the answer is yes. The British Dietetic Association, along with the associations from America and Canada and various other countries, have confirmed that a well-planned vegan diet can support healthy living in people of all ages, so from cradle to grave. So how do we know that this way of eating is healthy? So we have some very basic sort of observational data from regions around the world that have been coined by the term the blue zones. So in these 5 blue zones that are listed here, it's noted that people are more likely to live long, healthy lives and more likely to reach 100 than anywhere else in the world. And of course, it's not going to be just diet that they share in common. There's about 9 healthy lifestyle factors that they share. And actually, one of the most important ones is having healthy social connections. But if you delve deeper into the diet of the blue zones, this is from the website of the researchers, 95 to 100% of the diets are plant-based. So there's at least one blue zone in Loma Linda where there's a high number of vegans eating 100% plant-based diet. But in general, the diets share these common factors. They go mainly whole rather than being a processed food. They stick to minimally processed plant foods. They share in common having beans on a daily basis. They drink mostly water for thirst, snack on nuts, go easy on the fish, eliminate eggs, slash the sugar, reduce the dairy, retreat from meat. So something similar to the Eat Lancet Planetary Health plate. We have further data about the health of vegetarians and vegans from two large prospective cohort studies, one from the US called the Adventist Health Study 2, and one from here in the UK, EPIC Oxford, because the researchers are in Oxford, but has participants from all over the UK. And they've been running for decades and reporting health outcomes. And of these cohorts, around a third are either lacto-vegetarian or vegan. And there's some headline messages from the studies, of which might have been a separate talk in itself, but just to note some of the benefits of eating a more plant-based diet or even excluding animal foods from the diet. So you can see here stepwise reduction, for example, in body mass index as we move from omnivorous diet to vegan. So the vegans are the only ones in the only diet group that stick within the healthy BMI range in these two cohorts. You can slash your risk of type 2 diabetes by up to 50% if you're vegetarian or vegan. In addition, vegans have significantly reduced risk of hypertension in the order of about 63% and more likely to have a cholesterol level in the normal range. And this all translates into significantly lower risk of ischemic heart disease, around 25 to 30% reduction. We have data from non-Caucasian cohorts, so the Sushi's health study from Taiwan, where many of the Buddhist volunteers there follow a plant-based diet. And again, you have better health outcomes for those who are following a vegetarian and vegan diet, lower body weight, less type 2 diabetes, less fatty liver, gallstone, stroke, and interestingly, less medical expenditure, around 15% less expenditure on outpatient appointments and medications. And we've had a recent report from that same cohort from Taiwan on a health concern that really is a global problem and only increasing. And here they were able to show that people on a meat-free diet had a 33% reduced risk of dementia. And of note, in Taiwan, citizens tend to eat much more in the way of fruits and veggies and soya foods. So their diet pattern is different, of course, from the UK population. And they usually, the Buddhists at least, usually avoid tobacco and alcohol consumption. And here from the UK, we have a very recent report from the Biobank study. Almost 500,000 participants followed for 11.4 years, looking at the incidence of cancer in those who are consuming meat and those who are not. And in general, those individuals who do not consume meat, so vegetarians, have a 14% lower risk of cancer, with significant reductions in breast cancer risk and prostate cancer risk for those that exclude meat from the diet. And this is consistent with data from other cohorts. Now, of course, we don't have huge amounts of data on the health of vegetarians and vegans, and so researchers have developed this plant-based dietary index by which to score food frequency questionnaire data to really assess the impact of various types of plant foods and animal foods on health outcomes. And with this dietary index, healthy plant foods are scored with a positive mark, so fruits, vegetables, whole grains, beans, nuts and seeds. Unhealthy plant foods are scored negatively and all animal foods are scored negatively. So you can come up with a healthy plant-based diet index and an unhealthy plant-based diet index. And I've just summarised quite a few studies in the data, but that really show a common theme. If you just stick with looking at this middle healthy plant-based diet index score, you can see that those following the healthiest plant-based diets in general have significant reductions in coronary heart disease, type 2 diabetes incidence, stroke, renal failure, fatty liver, and also reduce their risk of premature death. The opposite, unfortunately, is true of unhealthy plant-based diets, as you might imagine. So if a diet is centered around refined grains and sugars and low in fiber, regardless of whether it's based around animal or plant foods, it's going to be detrimental to health outcomes. And this type of scoring system and analysis of diet data was used in the Zoe COVID symptom app data analysis. And we had this report from late last year showing us that a healthy plant-based diet, as I've described in that table, was able to reduce the risk of getting COVID-19 by 10% and reducing the risk of severe COVID-19 by 40%. And this was in a cohort of over 500,000 participants from the UK and the US. And this is just a reminder for me to say that, clearly diet is not always a choice, and socioeconomic factors really do have a major impact on our lifestyle habits and also our health outcomes. And this was highlighted in this study, that together socioeconomic factors and dietary risk factors together accounted for a third of severe cases of COVID-19. But the benefits of a healthy diet were seen across the different socioeconomic groups in this study. So what about the international consensus on healthy diet for good health? So we have the guidelines from the American College of Cardiology, Primary Prevention of Cardiovascular Disease, 2 diet patterns mentioned, plant-based like I've described, and Mediterranean. We've got just published, literally 3-4 weeks ago, a statement by the American College of Lifestyle Medicine endorsed by 7 other US health organizations, stating that remission of diabetes should be our aim, and when we are using dietary interventions, they should be centered primarily around whole plant foods with whole grains, vegetables, legumes, fruits, nuts and seeds, while avoiding or minimizing meat, refined food, ultra-processed foods and foods with added fat. So essentially a healthy plant-based diet. And for my specialty in cancer care, we've got our cancer prevention recommendations, which clearly state that we should be eating a diet rich in whole grains, vegetables, fruits and beans, whilst minimizing fast foods and limiting, I would say, avoiding red and processed meat, which really are not necessary in the diet. And of course, processed red meat has been classified as a group 1 carcinogen and red meat as a group 2A carcinogen. And country-based guidelines are really catching up with this. So 2019, we've got the Health Canada dietary guidelines, and I always ask people and then forget to ask at the end what is missing from this plate, but do have a think and pop it in the chat. But you've got half a plate of fruits and vegetables, a quarter whole grains, and then a quarter protein-rich foods, and it's clear in the text that we should be choosing plant sources of protein in preference to animal sources, and make water your drink of choice. And then most recent guidelines that I've come across are from Denmark: eat plant-rich, varied, and not too much. So a bit like the Michael Pollan quote. And then more recently, we've got guidance from the UK government. This came out in May, and it really relates to the overlap between our individual health and climate health, and applying an all our health approach. And when it comes to diet recommendations, it clearly states that foods most damaging to our health are those with the highest emissions, pollution, land and water use, and that diets rich in plant sources of food and lower in animal sources of food have significantly less environmental impact and have benefits for health and the environment. So really our own government endorsing a more plant-based approach. Now, people like me get fed up when vegan or plant-based diets are referred to as restrictive and nutrient deficient. It's far from the truth. A plant-based diet is varied and abundant and full of flavour. But of course, all diet patterns need attention to certain nutrients, and that's no different from vegan diets. And this was clearly showed in this meta-analysis of 141 studies just published earlier this year that looked at nutrients that might be inadequate and those that might be favourably high in 3 different diet patterns: vegans, vegetarians and meat eaters. And you can see that there's just the same number of inadequacy and high intake for all diet patterns. And when it comes to 100% plant-based diet, we all know that vitamin B12 needs to be supplemented. It's not found in animal foods or plant foods. It's made by microorganisms, and we eat animals as a sort of go-between, as it were. All diet patterns need to pay attention to vitamin D, and we as vegans have a lower intake of long-chain omega-3 fatty acids, so emphasising sources of short-chain omega-3 fatty acids such as chia seeds and flax seeds and so forth are a good option. But there's plenty of nutrients that the UK public are deficient in usually that are abundant in a plant-based diet. And the authors conclude, as plant-based diets are generally better for health and the environment, public health strategies should facilitate transition to a balanced diet with more diverse, nutrient-dense plant foods. So I just wanted to end with a good news story, and that really it is never too late, and these sorts of dietary interventions really can work with the right support. And this is my father. He had a Whipple's operation for presumed pancreatic cancer back in 2004 and has all the typical South Asian risk factors, unfortunately, for cardiovascular disease as well. But finally, 16 years after the operation, he was diagnosed with pre-diabetes. He also sort of met criteria for metabolic syndrome with very high triglycerides, an elevated BMI, and obviously pre-diabetes on the HbA1c. And I wasn't sure whether this was even remotely reversible or able to be put into remission, but he gave it a good go and saw a colleague of mine who helped him adopt a healthier plant-based diet, daily walks, resistant exercises, and within 7 months he's managed to reverse that trajectory and is no longer pre-diabetic, and that's maintained up until today. So really is never too late, and my dad's 79 now and happy on a plant-based diet. So I hope what I've presented today is a large body of evidence supporting plant-based diets for prevention and treatment of chronic disease, and that national and international guidelines are catching up with this evidence, and that of course we can't just consider our diet choice in the context of human health, and it needs to be considered in the broader context of global planetary health. So coming back to some actions that you might want to think about taking if you haven't already, it really is straightforward to add in more plant foods and eat less of the animal food. So to think of your everyday favourite meals and how you can make them more plant-based. It's simple as, you know, changing your mincemeat bolognese for a lentil bolognese or your chicken curry for a tofu curry. Take a plant-based challenge and ask a friend to join you, and I'll come back to the challenge that we offer at Plant-Based Health Professionals. And given that I've told you that the most important predictor of your patient's health currently is their diet, we should really make a point of supporting our patients to adopt a healthier plant-based diet. So we have this 21-day challenge, which you're welcome to use your phones to scan the QR code right now. If you want, it will take you to sign up page for free, where you'll get to receive daily emails and recipes and motivational videos and information for 21 days. And do share it with your patients. It's very appropriate level of information for our patients. If you want to learn a bit more, I've got my first book out with my sister, Eating Plant-Based, and then we have a clinical textbook coming out in September to really bring this evidence and practice into mainstream medicine. And this is the course I run at the University of Winchester, open to everybody, 30 CPD hours, self-paced over 8 weeks. It's received excellent feedback, so please do check that out on the University of Winchester website. And I will say thank you very much, because I think that's my last slide. And I will stop presenting.
That is fantastic, Shireen. Thank you very much indeed. I think there are a few people who have put a question. I'm just going to admit somebody. So I think, is it Ewan Simmons? Has said, shall I leave you to ask your question?
It's not. Oh,
You're on mute.
am I unmuted now? Apologies, it's not you and it's Sharon Simmons, but for somehow it's on my son's login, so I apologise about that. No, the question was, a lot of the diets that my colleagues are promoting in diabetes are actually, such as the keto diets, etc., are advising very little fruit. Although I know you've presented evidence there on, you know, the reduction in type 2 diabetes. So what are your thoughts on that? Because a lot of the diets that patients can access, such as on Diabetes UK, will be promoting things like the keto diet, etc.
Yeah, no, it's a good question. And actually, it's worth taking a look at the statement from the Scientific Advisory Committee on Nutrition that brought out quite an extensive review on lower carbohydrate type diets. Now, There's more than one way to address high blood sugars, and one way is obviously to limit the amount of carbohydrates in their diet. And as a short-term approach, that clearly does work for some people, especially with supporting weight loss, as you remove quite a lot of the refined grains and sugars, which we know are such a problem in our sort of current typical British diet. And weight loss by any means will help bring down the blood sugar and promote insulin sensitivity. And of course, if you don't eat carbohydrates, your blood sugar levels are going to be lower. But so I think as a short term, there can be some benefits there, and it comes down to talking to the patient about what their preference is. But I would be very guarded about the long term. So all the reports that have looked at these low carbohydrate diets, including the report that I presented in my presentation, clearly state that there's no data beyond about 6 to 12 months with following this way of eating for the long term. It naturally tends to be lower in fibre and all the foods that we know promote health, which include fruits and vegetables, whole grains, beans. And when you're limiting carbohydrates, you're limiting some of these healthier foods. And the large prospective cohort studies have clearly shown that in the longer term, that low carbohydrate diets, especially if carbohydrates are being replaced by animal sources of fat and protein, increase your risk of chronic conditions like cardiovascular disease, diabetes if you haven't got it already, and also premature death and certain cancers. So really, I think it can merely be used as a short-term fix to kind of bring things under control quickly. But in the longer term, the type of diet that I've described is the one that is endorsed as being healthy because it's full of all the foods that promote good health and ultimately prevent diabetes. There's absolutely no study showing an association between consumption of fruit and increased risk of type 2 diabetes. And in fact, there's even been studies in pre-diabetes and diabetes where people have been forced to eat like 20 portions of fruit a day, and there's actually improvement in insulin sensitivity. We've actually had a head-on-head study at a metabolic ward of a plant-based diet versus a keto diet, showing that yes, a keto type diet can reduce your blood sugars, but it really does not improve insulin resistance because it's not dealing with the root cause. And in at least a third to half of people, there's a rise in LDL cholesterol. So you don't need to make these compromises when you are adopting a healthy plant-based fibre-rich diet, in my view.
Brilliant. Thanks very much for that comprehensive answer. Has anybody else got any questions? Just unmute yourself.
I'd like to know what everyone thought was missing from the Health Canada guide, because I always forget to ask people their thoughts.
I think I know, but I've seen you talk before.
Well, I'll just say that they've removed dairy as a food group. Obviously there's a choice to consume dairy if you're tolerant to lactose within the protein group, but you'll have seen it was water for thirst. There's no requirement for dairy consumption, and that was in acknowledgement of the science that doesn't support the requirement for dairy. Also, that 70% of global population, particularly those from the global south, are lactose intolerant, and environmental concerns.
So it looks like Katie Hutchinson has a question. What's your opinion on intermittent fasting alongside this?
Yeah, and it's an interesting question, and I think we've got a lot still to learn. And I find the data quite compelling, but of course intermittent fasting seems to have different definitions, and I think it depends kind of what you're using it for. So my assessment of the data, and that's my sort of personal assessment so far, is that when you're using this sort of way of eating, the intermittent fasting, purely for weight loss, then it doesn't seem to have any advantage over calorie restricted diets, in that if you're eating in a shorter window, you're generally eating less calories, and that's equivalent to if you were going to stretch it over the day but lower your calorie intake. So I think that then comes down to personal a decision about how you want to eat. I think probably the most compelling data is that it's useful to have around 12 hours of not eating in the day and to follow your circadian rhythm. So to be eating more in the morning with your breakfast, slightly less at lunch, and then the smallest meal at dinner. And that really does seem to sort of be able to promote healthy weight and insulin sensitivity if we eat around our circadian rhythm, and then sort of finish not too late and then have a 12-hour overnight fast. I think there's I'm quite intrigued by the data from sort of Walter Longo's group on what does he call it? Where he has just 5 days of very low calorie, about 800 calories. So that sort of intermittent short-term fast that seems to have this way of resetting metabolism and lowering IGF-1 levels and insulin resistance and beyond the period of time that somebody has fasted. So I think watch this space, but I don't think that's ready for prime time.
Great, thank you. I've got a question that's come in from somebody, Matt Sawyer, who couldn't get on with my link, my useless IT skills. So my apologies to anybody else. But the question was, is there any link between dairy and prostate cancer or BPH?
Certainly, I think there's a fairly strong association now between dairy consumption and prostate cancer. That was has been shown in a number of meta-analyses now that higher consumers of dairy have an increased risk of prostate cancer. So it's in the order of about 400 grams of dairy a day increases your risk by about 7 to 9%. And certainly we know that individuals who exclude dairy or sort of vegans do have a reduced rate of prostate cancer or a reduced incidence. So I think there is good observational data. I don't think we'll ever have a randomized intervention study, but what we do have is a small study of early stages of prostate cancer, 93 men randomized to a plant-based diet and other healthy lifestyle factors versus usual care, and the plant-based group was able to stabilize and reduce their PSA level over 1 to 2 years. So there does seem to be some interventional data there as well. Yeah, I think that there is an association, and that should be taken into account when we're counselling high-risk patients.
Thank you. And another question, are you concerned about adequate calcium intake in less well-informed vegans long-term?
Yeah, well, many people are less well informed about diet in general. So as I've said, there's nutrients that we need to be aware of in all diet patterns. And yes, I agree that vegans need to obtain enough calcium. We know from the EPIC Oxford study in that cohort, in general, on average, people were not getting the recommended 700 milligrams a day. So yeah, we do need to educate people and empower them to make the right decisions. And it's really not that difficult. We just need to make some healthy swaps. For some people starting out, having the fortified plant-based soya milks, for example, and the yogurts are a good way of getting enough calcium. So you'll get at least 200 milligrams in about a cup of soya milk and calcium set tofu, beans and greens. I think in general, the British public are not eating calcium-rich plant foods, and I think that's a problem. If we think that most people don't even eat a portion of beans, and 28% of adults only are eating 5 portions of fruits and vegetables. So if you exclude something like dairy, you're going to have to replace it with healthy plant sources of calcium, and that does require a small amount of education and upskilling in nutrition knowledge and purchasing.
And then Rebecca Lai has her hand up. Would you like to unmute, Rebecca?
Sorry, I tried to put it in a chat box, but I can't find a chat box on here for some reason today. So I just had a little question just about in terms of like you say, that the evidence is quite compelling in terms of the improvement, and I just wondered whether there was any data on the timeline of like how long you would recommend someone to be having a whole grain plant-based diet when they would start to reap those rewards of improved health.
Yeah, no, that's a great question, and I think it is very individual and depends on the extent of changes somebody needs to make and are prepared to make. So the benefits are proportional to the degree that you're willing to shift to a healthy plant-based diet. But there's certain metabolic risk factors that really respond within a couple of weeks. So for example, bringing down blood sugars, you have to be careful within the first 3 to 5 days for people with type 2 diabetes on medication, because they will become hypoglycemic. Certainly blood cholesterol, you'll see improvements within a couple of weeks, and same with blood pressure. Weight loss, like with any sort of diet, you know, you're going to be aiming for sort of slow, steady, consistent rather than a sudden drop. So, you know, probably easily find a couple of pounds, if not more, depending on your health goals of losing weight. And then, you know, the longer term benefits of reducing your longer term risk of cancer and cardiovascular disease, such as ischemic heart disease, are a little bit difficult to quantify. So the biomarkers of health, you'll be able to change within a few weeks, and that's why people patients like it, because there really is quite instant gratification, as it were.
Brilliant.
That's great. Thank you.
Sorry. Thank you. Thanks for that. So I was asking this of somebody the other day, and they were saying, well, if everybody changed to no, if there was no cattle, where would the manure come from for the crops?
Yeah, no, great question. So I'm lucky enough to have a father who's an expert in conservation agriculture and sustainable farming. He spent his whole career in that field. So there's absolutely no reason why we need animal manure for fertilizing crops. So we use it for things like nitrogen. We know that the atmosphere is full of nitrogen. We just need to farm in a way where we use legumes and other nitrogen fixers that will be drawing out that nitrogen from the atmosphere into the soil. We need to regenerate our soil, so the earthworms and the fungi and what have you can be there to do the jobs that they're meant to do, which is to digest the biomass and recycle it. You know, the earthworms will chew up all the biomass and poop it out and be regenerating the soil. And there's there's living examples of this way of farming. So there's a growing movement of veganic agriculture here in the UK, and there's farms that are fully vegan, organic, and using green manure. So it, as in not manure, but green, a replacement for manure, which is essentially using cover crop rotation and using legumes to in the way that they should be, which is to fix nitrogen into the soil. So it's not necessary, and like with all things, we just have to change the way of thinking and doing. And as I say, Father's been advocating this for a long time in conservation agriculture, which does not require animal inputs. It has really taken off globally, less so in the UK, that's still sort of stuck with the old-fashioned tillage paradigm of farming.
Wow, what a father to have. That's fantastic. Thank you. That's really useful to be able to feed back, actually. And one more question about grass-fed beef. This seems to come up. I heard George Manibo, I think, talk about this recently on a podcast, saying that it's a nonsense and we should, that's going to be excluding a large sector of society if we just go for the grass-fed stuff, although the grass-fed farmers will say that it is much better for you.
Yeah, so I guess we have to think what much better means. Is it better for human health? I don't know. I've not seen any long-term data suggesting that consuming our beef that has been fed on grass is any better for human health when it comes to cardiovascular disease, cancer, type 2 diabetes, etc. So we don't have that. We can hypothesize that because it might be leaner and there may be some more omega-3 and there might be less antibiotic resistant bugs in that meat, and that it might be better, but I don't have any solid science. So I'm happy to have that sent to me if anyone else has got some up-to-date data. So then it comes down to Planetary Health. And yeah, I agree, it is better, but is it the best that we can do? We have to remember that in the UK, 70% of our farmland is already dedicated to raising animals for food. So 70% we're already using. Yet what we eat from animals, 85% comes from factory farms. And as George Monbiot keeps saying, you're getting around 1% protein return on all that land that we're using to farm animals. And so if we all suddenly wanted to move from factory farming, where 85% of our animal calories are coming from, to grass-fed or, reared outside or whatever, we would need to vastly increase the amount of land dedicated to animal farming, which is just not possible. And although initially there can be some advantages for carbon storage, the studies have clearly showed that the land will ultimately get saturated, and it's a much more effective way of storing carbon is to just allow the land to go back to its original form, the wetlands, the forests, the woodlands that were here all those centuries ago. So yeah, it might be a bit better, but it's not the best we can do. And as you've said already, some of us might be able to carry on affording to eat grass-fed, but the vast majority of what we're eating is not coming from that way of farming. And if we really want to shift all our current animal consumption to that way of farming, there is not enough land, water, resources in the world that will allow us to do that on the scale that we want to. We still need to reduce our meat consumption by 90% in the UK, even if the remainder of what we eat is from grass-fed.
Oh, right. Well, that's absolutely brilliant, Shireen. Thank you so much. I probably ought to call it a day for the people who are not part of the Birmingham and Solihull group or who might want to join. But I'm so grateful to you, Shireen, for coming. I'm sorry my tech skills have been useless, and I've got to do a little bit of learning before the next time I try and send people links. But anyway, it's worked for now. Yeah. Lovely. Thank you very much indeed.
No, it's an absolute pleasure. I'm just going to, sorry to interrupt. Shall I stop recording so that then I'll email you the recording. But I'm also going to put my website address into the chat. And anyone who wants to use the resources, I should have said we've got so many free resources that you can just use with your patients and yourselves. Got a plant-based eat well guide, all sorts of things. So it's plantbasedhealthprofessionals.com. So please use and distribute and put up in your surgeries.
That's brilliant. And the QR code that you put up, is that for us to share with patients directly?
Yes, absolutely. Either share it or go, send them the website link. It's free, available to use for everybody.
Okay, brilliant. Yeah, if you wouldn't mind stopping recording.